Many people find nurse practitioners preferable to the traditional doctor or clinician for a number of reasons. And the one that keeps coming up over and over again is that they're better communicators. Nurses in general tend to be better communicators than doctors are. Perhaps it's because they're less harried, perhaps because there's less time pressure on them in some cases. But I think in general it goes to the different kinds of training they receive as they go through their clinical education. And nurse model is very patient-centered and patient-focused. They're the patient advocate. Physician model is clinical-centered, so they're more treatment-focused. They look at the disease instead of the person, whereas nurses tend to look at the person first and then the disease. A friend of mine got her mother in to see the only nurse practitioner within a 45-minute drive of where her mom lived in Florida, because she wanted the better communication. One of the things her mother had complained about as the Alzheimer's disease progressed was that her physician wasn't taking time to listen to her, wasn't taking time to talk to her enough. So through a lot of phone calls and working with a care manager, they were able to find a nurse practitioner that specifically dealt with older adults and had experience with Alzheimer's patients. And even though it was a huge burden for her mother to travel 45 minutes to go see this person, it made for a much better clinical relationship. Her mom felt listened to, her mom felt understood, and importantly, her mom had better compliance with the regime, taking medications and taking care of herself, because she felt like this person almost could be a friend. Nurse practitioners kind of take on a dual role. They're clinicians, but they're also a support person. And many people find they create a closer bond with their nurse practitioner than they do with their physician. It works for some people, but on the other hand, others will say, well, you know, I'm paying to see a doctor, I only want to see a doctor. And again, we go back to the whole scope of practice issue, given the variables within the 50 states. Some states, nurse practitioners can prescribe and they can treat and they can do almost everything a clinician does to a point. Other states, nurse practitioners are very limited in what they can do. For example, can only operate under a physician's direct supervision. So it becomes very confusing, and again, it really boils down to what state are you in and what are the laws within that particular state. If you happen to be in a state where nurse practitioners have a broad scope, then very often they can substitute for the clinician, for the physician. In other states, it may be as an adjunct. You may see the nurse practitioner for standard care, weight measurement, medication reconciliation, but the physician may still have to do the traditional visit.